Hello, and welcome to week 15. This week, we're going to talk about the female reproductive system. And this is our last live chat for this course. So look at you, you made it to the end. Just a little bit more to go. Remember, next week, well, specifically December 9th and 10th, your final exam is available to you. You want to make certain that you make time during those anytime you want during those 2 days for you to sit and take your exam. You have to complete it in one sitting, of course. And I know you'll do great because you've been working so hard all these weeks to learn medical terminology. So then you'll have a little break, right? And be able to enjoy the holidays. And that is fantastic. Okay, so let's talk a little bit about the female reproductive system and all the terms that relate to that. So we're going to start here with the breast. And whether you are a man or a woman or a human, okay, you are familiar with the breast. This is sits on top of the pectoralis major muscle, and it's filled with ligaments that suspend the skin. Okay, and you can see here in this great illustration on the left side, those little white dots, if you will, that's your ribs, okay, going around your chest from your spine. And then on top of that, you have your pectoralis minor muscle. And on top of that is your pectoralis major muscle. And maybe you've heard of people, particularly men, as they exercise and they talk about working out their pecs. That's the pectoralis minor and major muscles that they're working out, that they're exercising. Okay. Then you have those lymph nodes, the axillary lymph nodes, and those are the lymph nodes that go into the armpit. Axillary lymph nodes that, filter lymph fluid and help your body fight infection. Fat, remember we talked about those. Okay. And then you have the fatty tissue. And in this case, this is what gives the breast its shape and its bulk. Okay. The lobules are the mammary glands. That might be more familiar to you. And that is where the milk is produced during pregnancy to accomplish breastfeeding of the infant. Okay. Then we have the external part of the breast, which is the areola, which is that dark circle of skin that surrounds the nipple. And then, of course, the nipple itself, and the ducts that come from the mammary glands to passage the milk through the nipple so the baby can drink. It all comes through the nipple itself. Okay. All right, lots of words, lots of medical terms to describe the breast. And the only difference between an A breast and a D breast is the amount of fatty tissue that is surrounding. That's not to say anybody is fat. This is a normal, necessary part of the human body. Okay. All right. Next, we're going to the lower part of the female genitalia, and we're going to start on the inside. And as you know, there are the ovaries. The ovaries are where the eggs are produced and stored until it's time for them to move along in the infundibulum, okay, which is the part that leads to the fallopian tube. Okay. And the fallopian tube is where the egg travels to the uterus, or Mr. Sperm meets Miss Egg, and they have a little tete-a-tete right there in the fallopian tube. And then in that case, instead of just the egg dropping into or traveling into the uterus and eventually passing through menstruation, instead you have a fertilized egg that will travel into the uterus. And if being pregnant is what is desired, then it sticks and implants into the wall of the uterus, which is lined with the endometrium. And then that little Y-shaped section there, that red section in the center, kind of looks like a weird rabbit with the ears a little bit, okay? And then if there is a fertilized egg, then that obviously will get bigger as the egg, the zygote then, okay? So an egg is an egg. A sperm is a sperm. When the sperm and the egg get together and they hit it off, okay, it becomes a zygote. And then the zygote travels into the uterus, and the zygote will grow into an embryo. And then the embryo becomes a fetus. And then the fetus becomes a baby. Oh, how nice. Okay. All right. So when the baby is ready to be born, or when the egg is being disposed of via the menstrual cycle, it will go down through the cervical canal, also known as the cervix. Now, you might be saying, wait a second, I remember that word, cervix, right? Do you remember the cervical vertebrae in your neck? Okay, that's also cervical. This is cervical canal or cervix. Okay, and yes, there's a reason why it's the same word, because cervix actually means neck. And in this case, the cervix is the neck at the juncture between the vagina and the uterus. So you can see how it's the same word, but it's not the same anatomical site. And women have two cervixes, men only one cervix in their neck. Women have in their neck, and that juncture between the vagina and the uterus on the inside of the female body. Okay. And that's a pretty simple setup, but it's amazing how it works and how things change. You can also see that if something goes wrong and the zygote, the fertilized egg, in the fallopian tube gets stuck, you can see how that would cause a real problem, because the zygote becomes an embryo, is growing inside that little 4-inch fallopian tube. And that can cause serious complications for the woman. So that's why that is cause of concern. We just got to make sure everything goes where it's supposed to go, when it's supposed to go there. Okay. All right. So there are lots of terms that are related to gestation, and gestation, we can start with that. The gestation is the time the baby is in the uterus. Okay. So this is how long does the bread have to be in the oven? Okay. That's gestation. The first trimester is from day 1, when Mr. Sperm meets Miss Egg and they get together, okay, up to 13 weeks, 6 days. So technically that's less than 14 weeks. As soon as we get to the 14 weeks from the day of the little matchmaking in the fallopian tube, it enters the second trimester, which is 14 weeks, 0 days, up through 27 weeks, 6 days. Okay, so you'll notice each trimester is approximately 14 weeks. 14 weeks for the first trimester, 14 weeks for the second trimester, as we are less than 28 weeks. When we get to 28 weeks, 0 days, that's that first day. It's the third trimester, and that's where we are until delivery. Okay, now you might say, if we add 14 to 28, that's 42. And so that whole 9-month thing is really kind of not exactly, it's kind of rounded off, all right? But a full-term pregnancy is considered 38 weeks up to 40 weeks. So anywhere from 38 to 40 weeks is a normal gestational period. We have less than 37 completed weeks is a preterm infant. And I don't know, it's really amazing to me how far we have come in healthcare and the care for premature neonates has absolutely been amazing. I can remember in my career when a baby who was born less than 5 pounds had very little chance of survival. And I don't know if any of you saw the news in the last week or so. I want to say there was a baby who was born 2 pounds who is surviving and thriving. And that is a testament not only to that child's genetics, but also to what healthcare has been able to do and care for these preemies. Of course, it's always better for the bread to bake the full amount of time. Okay, one of the reasons why you will learn that premature children have respiratory syndrome is because the lungs and the surfactant, which is kind of the lubricant for the lungs to open and close or expand and contract, is one of the last things to develop for the neonate, for the fetus. Okay, so we want to keep that baby in there at least till 38 weeks if possible. And again, there's a lot that can help accomplish that, but premature babies are a lot more survivable than they used to be. And if you can believe it or not, we do have some bread that's overbaked. Okay, a post-term neonate is measured by 40 completed weeks up to 42 completed weeks of gestation. And yikes, okay, remember, if a month has an average of 4 weeks, that's 10 months, 10 to 10 and a half months. And prolonged gestation of a neonate is over 42 completed weeks or 294 days or more. Although typically the mother will be induced, which is medication provided to urge the baby to come on out, come on, it's time, don't be shy, we can come, all right, okay. All right, and then lastly, we have labor and delivery. And you'll notice that the baby on the left side is not in the right position. This baby is inverted, and that's a problem. You want the baby to come out head first. There are less complications that way. Sometimes they can manipulate the baby externally by massaging and moving the baby around. Other times it might go to a C-section. But, again, this is something that healthcare professionals are aware of. All right, so the last few terms that have to do with pregnancy, have to do with things that will be identified on the patient's chart. And as you see on the very last line, the abbreviation may be G2P1 or something like that. A G, the letter G, and then the letter P with numbers. What do they mean? The G stands for the Latin word gravida, which refers to how many times this woman has been pregnant. So that's why you will see G with a number. How many times has this woman been pregnant? Okay, then we have the P. P stands for parity or para, which reports how many times this woman has given birth to a baby after 20 weeks of gestation. So that's about into the second trimester. Okay, so you may see, for example, G2P1, which tells you that the woman has been pregnant twice, but only had one birth after 20 weeks of gestation. Or you might see G1P2. What would that tell you? That would tell you that she was pregnant once, gave birth to 2 children, also known as twins. Okay. All right. In some cases, you may see an A, which is short for abortus, to report how many pregnancies did not come to term or make it past the 20th week. Now, I want to reinforce, especially right now with everything that's going on in politics, which has nothing to do with healthcare, okay? This is the Latin term for the ending of a pregnancy prior to the 20th week. This may be what we call a miscarriage, which is the natural abortion of the pregnancy. Abort, as you know, that's a word that means stop. That's all it means, is that the pregnancy was stopped prior to the 20th week. This does not mean that the patient went and had a legal abortion as we know it. This could be a natural event. So we want to make certain that we do not and never should judge our patients, not our place. We do not get involved in the personal relationships or anything about our patients. We only care about how we can help them. That's our job. This is not our job to get involved in any other instances of, oh, this woman had an abortion, if that's against your religion. I respect that. We all respect that. Not an issue for a healthcare professional. Okay, and as I said at the beginning of this slide, this is also typically noted in a woman's chart as G with a number, and then the letter P with a number, and there may be an A with a number. Okay. This is for you to interpret. Some physicians will write out gravida para. Okay, others may use the abbreviation. Now you're smarter than everybody else. Don't you love that? I love that. Okay, so now that the baby is born, we're on to reinforcing your knowledge of these medical terms. Review this often. That's how they're going to stick in your head. Use a medical dictionary. Very, 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 very important, because you want to reinforce in your head, not what you think you remember, not what I think I kind of sort of, you want to reinforce what's accurate. And then that's what will stick in your head. And always query when necessary. Query me, your instructor, or query the physician who wrote the notes if you're on or when you're on the job. Okay, I want to remind you that Thursday, December 9th and Friday, December 10th, you have 48-hour access to your final exam for this class. You only get to take it once. You need to dedicate time during those 2 days to get in there and take it. Make sure you allot sufficient time so that you're not rushed. You can't think the best when you're rushed, okay? Remember, we're an online class. You could take it at 2 o'clock in the morning if you want, or 2 o'clock in the afternoon, whatever suits you. I'm telling you now, plan, okay? Make certain that you do the practice, so you make sure that your equipment for Respondus monitor is working fine. Do that as soon as possible. In case your camera is not working, in case you have a whatever with a whatever, you'll have time to talk to technical support or borrow another computer or come to campus and use a computer at campus, okay? But this is very important. Plan ahead. Today is December 2nd. You have an entire week, literally 7 days to 8 days, okay? No excuses, just get her done, all right? Finish up your week 14 work and then study. And if you need help, we have a medical terminology tutor available to you. You can just email her at this address for an appointment. And always, you can email me and we can email back and forth. I can provide you with answers to your questions, or we can set up an appointment to speak on the phone, or we can set up an appointment to Zoom or FaceTime or WhatsApp. Okay. I'm here to support you, and let's make me proud, because I'm always very proud of your success. Okay. You can do it. You can do it. You can do it. Any questions? Okay, then. Have a wonderful, get that final done next Thursday or Friday. So be done with it. And then you can relax for the holidays. Whatever holiday you're celebrating, happy Hanukkah, Merry Christmas, happy Kwanzaa, happy Chinese New Year. Whatever makes you happy, I'm there for you. Stay well and stay safe.